working with the respective manufacturers to finalize which will be the final list that will be included in the solidarity protocols. That list is not final at this point of time. So we are not yet clear which vaccines will be included for the Philippines.
Dr. Rabi, have we also identified how many individuals are required to participate in the trials?
For the Philippines, WHO was hoping that the Philippines will include up to 4,000 individuals. The Philippines has identified 10 vaccine trial sites, 9 of them in the National Capital Region and 1 in Cebu. The idea is that there needs to be some level of COVID-19 transmission to measure the efficacy of the vaccines. But we've seen a decline in transmission rates in both Cebu and NCR. But we believe that the current levels of transmission are still adequate to trial the vaccines. However, that decision will be made once we have the candidate vaccines to come in.
Since the participants will be identified on a voluntary basis, are there volunteer participants and trials, and what is the information that you have, Dr. Rabi, with regard to that?
So on the number of participants, WHO was hoping that there will be up to 4,000 participants from the Philippines. Our understanding now is that the Philippines is looking at 2,000 to 3,000 participants joining the trial. We are hoping that that number could be increased because the larger the number of people we trial, the sooner we could get evidence of efficacy, safety, etc. The protocol that WHO has currently looks at volunteers between the ages of 18 and 60 years who will be included in the trial. Of course, there are some exclusion criteria, people having comorbidities, or especially people, pregnant ladies, etc., will not be included in the trial simply because we are evaluating the safety of the product at this point of time.
You mentioned evaluating the safety. Is there a way to ensure the participants of their safety? Will they be monitored individually and diligently?
That's what is expected of the Philippine counterparts, to do that monitoring on a weekly basis at a minimum, and follow up the recipients of the vaccine on a weekly basis at a minimum, so that any side effects, however small or minor, may be picked up early enough and reported. So this is what is expected as the contribution from the Philippine participant authorities who will be joining the trial. Of course, the solidarity trials are multi-country, multi-center trials, and the purpose is that it will help us to include a large number of patients. We are looking at up to 60,000 patients who could be included, so that we can have the evidence of efficacy and safety early in the phase 3 trials.
In September, the DOST, or Department of Science and Technology, earmarked a total budget of 89 million pesos for the Solidarity trial, as confirmed by the Department of Health. May we ask Dr. Rabi why a budget as this is necessary for the trial?
Let's be clear that the allocation made by the DOST is for the coordination of local efforts and for local expenditures. WHO takes the responsibility of shipping the vaccines to the country, providing the vaccines free of charge, and ensuring that any insurance for recipients are provided so that they are well looked after. Most of the expenditure earmarked by DOST is for logistical reasons, for management of the protocols, and for follow-up of recipients and ensuring that the trials go according to plan in the country.
Let's proceed to the media questions for Dr. Rabi. Yusek Rocky.
Okay, thank you, Secretary Martin. Good morning, Dr. Rabi. Questions from Red Mendoza of Manila Times. Two WHO experts.
Morning.
Good morning, sir. Two WHO experts, Mike Ryan and David Navarro, have both said that there should be a stop on lockdowns as it destroys economies. This statement has been given wide media play and is now being used by the WHO's critics as proof that lockdowns do not really help in the situation. What is the WHO's official stand on the statements of the two officials?
Thank you, Yusek Raki. This is a very important question, and we like to really clarify this. We have not said that lockdowns have no place. We have been clear from the beginning of this pandemic. In fact, since April, both the DG, our regional director, and myself have clarified. We want this response to be not only a health, but an economic response as well. So we are as interested as mitigating the health impact and ensuring that the economy is not damaged and economic revival is ensured. For this, it is necessary that early detection of cases, prompt isolation of close contacts and positives, and quarantining of those, and appropriate contact tracing and proper management of cases is ensured. If these measures are in place, together with compliance with the public health behaviors and the avoidance of the 3 C's, we could avoid large-scale lockdowns. That's what we've been advocating for countries right from the beginning of this outbreak. We don't view lockdowns as the primary response. And if you look at very carefully what Dr. David Nabarro and Mike Ryan are saying, they're saying the same message. We don't view large lockdowns as the primary response. The primary response should be a public health response. And when this fails, when the health systems are being overwhelmed, it is necessary to use lockdowns as a last resort. That is what we have been advocating right from the beginning. The early lockdowns help the countries to expand their capacities and be better prepared to deal with surges in cases. That's why we are seeing low mortality in the Philippines. And we are seeing increased diagnostics because the diagnostic capacity was increased. But we have not at any stage advocated that large-scale lockdown should be the primary response. This is very clear. So there is no actual flip or change in our position. We have always been advocating the same position.
Yes, Dr. Rabi, the WHO has announced that some low and middle income countries will receive antigen test kits funded by the Gates Foundation. Is the Philippines one of those countries who will receive those kits?
Thank you again, Yusek Raki, for the question. The question is important because there are many countries that still don't have capacity for RT-PCR testing. WHO has been clear that the antigen tests have significant limitations. Their capacity is limited to detecting patients with high viral loads in the upper respiratory tract. So using antigen tests will mean that a significant proportion of positive cases are missed, but this is a measure that will help low and middle income countries that don't have capacity for RT-PCR to have some kind of diagnostics. That is why WHO is advocating for those countries to use antigen tests in the absence of capacity for RT-PCR and not as a replacement for RT-PCR. I hope that is clear.
Questions from Christine Sambilio of ABS-CBN. What can the WHO say about the fact that the Philippines is now in the top 20 countries with the most number of COVID-19 cases and that our positivity rate is still above the 5% benchmark of the WHO? This despite a reported declining trend in the number of cases.
So, the number of cases reported in a country is dependent on its population size and its capacity to detect. So if you look at the Philippines has, from a population perspective, I believe the 12th or the 13th largest population among countries in the world. And from a testing capacity, a significant higher testing capacity than many other countries in this part of the region. So if you look at it, the fact that the Philippines is reporting a large number of cases and is listed as the 20th country with the most number of cases does not actually translate to high incidence at a population rate. So we have to be careful in interpreting data and not pick and jump to wrong conclusions. This is critically important. You have to look at it from a comprehensive perspective. What capacity do we have? How good are we at reporting, and what is the population rate of infections we are seeing? And in this respect, the Philippines has a significantly higher population testing rate than many other countries, and equally importantly, a much lower proportion of fatal cases than many other countries in the region.
What is your recommendation for the Philippines to improve its COVID response?
Again, I want to sound, I don't want to repeat the same message, but it is largely the same message. We need to ensure that we have consistent messaging from the government, from the media, from the private sector, recognizing the importance of the three key public health behaviors that WHO has been advocating right from the beginning of this pandemic: hand hygiene, respiratory etiquette, physical distancing. Couple these three key public health behaviors with the avoidance of the 3 C's. Avoid crowded, congested, closed places so that you minimize your risk of infection. And as we recognize the need to bring back the economy, we need to carefully calibrate these measures so that we don't allow for a significant increase in transmission again, as we've seen in many other countries now in Europe and North America, who relaxed completely their compliance with the measures and are now experiencing again a significant surge and a need for large-scale lockdowns. The secret of success is to balance these measures and ensure a smooth and gradual opening of the economy while controlling the pandemic till we have effective vaccines and therapies at our disposal.
Dr. Rabi, question from Marichu Villanueva of Philippine Star. Can you clarify, Dr. Rabi, which does WHO protect, the volunteer participants of a Solidarity test or the COVID-19 vaccine being tested?
Sorry, can you repeat that question?
From Marichu Villanueva of Philippine Star, her question: can you clarify, Dr. Rabi, which does WHO protect, the volunteer participants of Solidarity test or the COVID-19 vaccine being tested?
We are interested in the patient welfare. So if the vaccine is being tested on volunteers, our focus will be on protecting them. We want transparent sharing of information. That's why we are advocating that the vaccine trials are multi-center, multi-country, so that there is open access and sharing of information about the actual efficacy and safety profile of the products. And our core mandate is to protect the health of people, and we have not changed that up to date.
Question from Joseph Morong of GMA7. How far along is the WHO as far as the Solidarity trial is concerned? Any vaccine that is emerging to be a front runner to be used in the global tests?
That's a good question. There are, I believe, 2 or 3 candidate vaccines that are being reviewed very closely. But as I already mentioned, no final decision has been made. And in the absence of that decision, I am unable to mention which vaccines have been shortlisted or selected. I appreciate your understanding.
What is your comment on the Philippines being number 18 with most cases in the world? Does it mean that the strategy against COVID is not effective?
By number of cases, you may be number 18, or I believe it's number 20. I'm not quite sure. But if you look at and that number of cases is a reflection of how much you are testing. But the key issue is how many people are dying. And if you look at from the proportion of fatal cases, I believe that the Philippine response has been very proactive and very good in controlling this pandemic. Of course, it is still early. We need to ensure that we comply with all of the protocols that we've been following and ensure that we continue with that process, because if we tend to relax and become complacent, we run the risk of having another surge of cases. And as we haven't really zeroed and flattened the cases, we need to continue to stay vigilant and continue to increase our preparedness and response capacities, not only here in the National Capital Region and Metro Manila, but even beyond in other provinces where we are seeing small upsurges in cases now.
Dr. Rabi, question from Evelyn Quiroz of Filipino Mirror. Polio is a disease which can easily be prevented by vaccination. For the first time after 19 years, polio has re-emerged in the country. Is this an indication of the failure of the Department of Health's vaccination program?
That's a complex question that actually has about 4 or 5 questions in that. One of the reasons we view why we had a resurgence of polio cases is because of poor vaccination coverage, and that has been influenced by many factors, not only the responsibility of the Department of Health. There have been concerns about vaccine hesitancy and vaccine safety, not related to polio, which we know adversely impacted the uptake of expanded program of immunization vaccines or childhood vaccines, not only the polio vaccine. And so it is critically important that we act early to bring back the vaccination coverage. We know that the poor vaccination coverage also resulted in a large measles outbreak in the Philippines in 2018-19. So recognizing this, WHO is now working together with DOH, UNICEF, Rotary International and other partners in the polio response. That response has now been completed on the Mindanao Islands in NCR Region 3 and 4A, and we are embarking on doing the remaining areas of Luzon and Visayas starting on the 26th of this month. And also we want to support the DOH in its supplementary immunization for measles and rubella in anticipation of a possible large-scale outbreak, because we know that EPI vaccine coverage has suffered also as a result of the COVID pandemic. So we want to increase the immune levels in the young children and protect them so that we don't have a repeat of large outbreaks of polio, measles and rubella.
Okay, Dr. Rabi, question from Joseph Morong again of GMA7 with regard to COVAX. How soon can have a vaccine you think that can be for distribution?
The COVAX initiative is to ensure that the vaccines are universally accessible to all, and that we meet the principles that have been identified by the Strategic Advisory Group on Immunization of WHO. We have 6 principles that have been clearly defined by the SAGE for COVID vaccines. And the COVAX mechanism is a mechanism to ensure that, given the fact that the vaccine trials are undergoing, phase 3 trials are only about to commence large scale during this month or later, we don't expect vaccine to be available for population deployment before the middle of next year. So at the earliest, maybe June next year.
Thank you, Undersecretary Rocky. Lastly, Dr. Rabi, your message for the Filipinos who are continuously facing and battling this pandemic.
From the beginning, we have been giving one message. This needs to be a comprehensive, coordinated message across government, different levels of government, across private sector, and across the community. We need to work together. We need to work together to ensure that there is compliance with the basic public health behaviors that we have mentioned. We need to ensure that the physical distancing is maintained. This is critical to interrupt the transmission of the virus. And we need to ensure that we make every effort to protect the most vulnerable, dearly beloved elderlies, and people suffering from comorbidities. We have to continue to work together, and the message that we are tired, we want to go back to life as we knew it before. I think we have to park that for a time being and keep working so that we ensure that everybody is protected until we have good protection for everybody and we can go back to life as we knew it before. This is the new normal. We have to recognize that these behaviors are critical and important in this time, and that we maintain all of those behaviors to ensure that our efforts at protecting the most vulnerable continue to give fruit while we ensure that the economy gradually opens up and we minimize the suffering brought about by economic hardships for people in the most vulnerable categories. Thank you.
We are all hoping for the positive outcome of the Solidarity trial. Thank you so much for your time, Dr. Rabi Abeyasing from the World Health Organization.
Thank you, Secretary Andana. Pleasure to be here. Have a good day.
Sa gitna ng patuloy na paglaban ng ating bansa sa COVID-19, tuloy-tuloy din naman ang pagtuligsa ng ating pamahalaan sa iligal na droga, ang isa sa pinakatututukan ni Pangulong Rodrigo Duterte bago pa man ang pandemya. Kaugnay niyan ay makakausap po natin ang tagapagsalita ng Philippine Drugs Enforcement Agency, si Director Derek Carion. Good morning po, sir.
Magandang umaga po sa ngalan ni Director General Wilkins M. Villanueva.
Welcome po sa Laging Handa Public Briefing. Director, 1 week po matapos ang utos ni Pangulong Duterte sa PDEA para sirain itong confiscated shabu at ilang pang illegal drugs na nasa poder ng ilang law enforcement agencies. Ano na po ang update dito? Nakakomply po ba ang PDEA sa kautusan ng Pangulo?
Yes ma'am, katunayan po, kasalukuyan po ang ating paghahanda dahil sa October 15 po, itong darating na Huwebes, ay nakatakda po tayo magsunog ng at least 1 ton of dangerous drugs sa ating pong destruction site sa 13 Martires, Cavite, ma'am.
Opo. Director Carion, may mga katanungan po para sa inyo mula po sa media. Ang tanong
Yes,
po ni Evelyn Quiroz, dali lang po, Director. Ang tanong po ni
Yes,
Evelyn Quiroz sa inyo ay, the past 4 years of the Duterte administration has seen significant headway in the fight against illegal drugs, and then the COVID-19 pandemic happened. Has the pandemic affected PDEA's fight against the drug menace?
Well, nakikita naman po natin mula nung sinimulan yung pinaigting na kampanya laban sa illegal na droga, talagang tumaas po yung bilang ng ating anti-drug operations conducted, persons arrested, cases filed, and volume and value of drugs confiscated. Ngayon, nangyari po yung pandemya, naging hamon po ito sa lahat ng ating mga operatiba. Alam naman po ng lahat. Hindi lang po sa aming hanay, ngunit pati sa aming mga kasamahan sa Philippine National Police at sa National Bureau of Investigation and other law enforcement agencies. Napakahirap po magsagawa ng anti-drug operations, lalo-lalo na po ngayon sa panahon ng pandemya. Ngunit hindi po nangangahulugan dito na titigil po tayo, ma'am. Katunayan, sabi nga po ni Director General Wilkins M. Villanueva, kasabay po ng pagsalubong sa hamon ng COVID-19 ay ang pagpapatuloy ng ating pinaigting na kampanya laban sa illegal na droga sa pamamagitan po ng magkikipag-ugnayan natin sa ating mga kasamahan, lalong-lalo na po sa mga barangay, para mas madali po ang coordination at ang pagsagawa ng anti-drug operations sa iba't ibang lugar po. And ibig po sabihin dito, hindi po tayo titigil dahil ang mga sindikato po ay hindi rin tumitigil sa pagpapakalat ng illegal na droga sa ating bansa. Katunayan po, ito lamang nakaraan, nagsagawa po tayo ng simultaneous conduct of implementation of search warrants. Kaya 2 drug din po ang aming nalansat sa pinagsalim na puwersa ng PDEA Regional Office NCR at Malabon City Police Station 7 nang magsagawa po tayo ng simultaneous implementation of search warrants. 2 drug den po, drug den maintainers at 5 drug den visitors ang naaresto at humigit kumulang na 25 gramo po ng shabu ang ating nakumpiska rito, nagkakahalaga ng 170,000 pesos kasama mga drug paraphernalia po, ma'am. So in total po mula noong July 1, 2016 to August 31, 2020, mula nang nagsimula po yung ating pinaigting na kampanya laban sa illegal na droga, 603 drug dens na po ang ating nalansak. Ito po yung mga tinatawag na one-stop shop facilities na kung saan na maaari pong bumili at gumamit ng illegal na droga ang mga parokyano po nila.
Opo. Marami daw pong pending at archive cases ang nakalink sa mga confiscated illegal drugs na ito na nasa halos 700 kilos ng shabu at nakakahalaga ng halos 4.76 billion pesos. Ano daw po ang mangyayari sa mga pending cases na ito at patuloy po ba itong tututukan ng PDEA?
Opo, ma'am. Katunayan po ang ginagawa po natin ngayon ay actually na-bring up po itong issue na to during the Senate hearing kung saan natanong po ng mga kagalang-galang na senador yung estado nitong mga pending cases natin. So ang naging action taken po rito ni Director General Wilkins M. Villanueva ay sumulat po tayo ng liham sa kagalang-galang na Secretary of Justice po natin, Secretary Bernardo Guevara, at humingi po tayo ng tulong, ma'am, upang yung mga handling prosecutors po dito sa mga pending drug cases na ito ay magkaroon po ng concurrence or sumang-ayon or tulungan pa tayo maghain ng motion dun sa iba't ibang korte. Kasi yung iba po may nakahain ng motion and then the others, we need a concurrence to the motion for the conduct of ocular inspection, the taking of representative samples, at ang eventual po na pagbigay ng court order for destruction nitong mga cases po na nakabinbin ngayon sa iba't ibang korte, kasama na rin po yung mga pending cases na archived and under automatic review. Actually, ma'am, to correct the figure, ang total po rito is something like 540.6 kilograms of shabu. At definitely po sisikapin po namin makuha yung mga kaukulang court orders po dito upang maisama po natin sa ating impending destruction on October 15.
Pero totoo po ba na meron pa rin kayo mga undestroyed drug evidence as far back as 2010 at gaano karami po yung confiscated drugs na hanggang ngayon po ay naghihintay pa rin ng court order for disposal?
Yes, ma'am. Katunayan po ang current inventory natin is at 2.82 tons of illegal drugs. Ang total value po updated po ito, ma'am, kasi noong nakaraang linggo 14 billion yung estimated value ng nasa kustodiya po natin. Ngunit dahil may mga nag-turnover po sa atin na mga other law enforcement agencies and courts upang may habol po sa ating upcoming destruction, ang current inventory po natin sa PDEA Laboratory Service ay nasa 2.82 tons valued at 15.189 billion pesos. Ma'am, ipaliwanag lang po natin kasi in fact katatapos lang po ng ating destruction of dangerous drugs. Noong pagkatapos pong umupo ni Director General Wilkins M. Villanueva, nagsagawa po tayo ng joint destruction of dangerous drugs kasama po ang Philippine National Police nitong August 21. Ito lang po very recently, kung saan ang halaga po nito ay more than 13 billion pesos worth of illegal drugs, weighing more than 1 ton. Kung saan ang bulk po nito ay mula sa Philippine National Police and about another 800 kilos, actually 2 tons po, more than 2 tons, 800 kilos po mula sa PDEA. So 13 plus billion po yan. Ngunit dahil po may mga patuloy po tayong large volumes of confiscation of illegal drugs. Kapag nababawasan po yung inventory natin, may pumapasok naman pong panibago. Kaya sa pananaw po ng mga karamihan, parang hindi nauubos yung illegal na droga, ito po ay dahil patuloy po ang kampanya natin and resulting in huge volumes of confiscations of illegal drugs. Ngunit makakaasa po ang buong sambayanan na patuloy po nating gagampanan ang ating panunungkulan, hindi lang sa operations, ngunit pati po yung pag-follow up ng mga kaukulang orders upang eventually po ay masunog na po natin itong mga illegal na droga na nasa ating kustodiya.
Pero Director, this is an ongoing problem daw po ayon kay Senator Franklin Drilon kung saan hindi daw po nasusunod ng implementing agency at maging ng judiciary ang batas na nakasaad sa Comprehensive Dangerous Drugs Act of 2002 na dapat after 4 days ng pagkakakumpiska sa mga ebidensya ay sisirain na ito. At ito po ay sa kabila rin ng pag-i-issue ng Office of the Court Administrator na isang circular order na dapat umanong sundin ng mga husgado sa paghawak ng mga kasong may kaugnayan sa drugs. Ano po ang sagot dito ng PIDEA?
Well, ginagalang po natin ang obserbasyon ng mga kagalang-galang na senador tungkol dito at ng iba pang mga hanay ng ating mga kababayan, maski ang pangkaraniwang mamamayan. Kaya nga po patuloy ang ating pakikipag-ugnayan sa Department of Justice at gayon din po sa iba't ibang mga courts. Mabuti nga po ma'am at nag-issue po ng tinatawag din po ng Office of the Court Administrator Circular number 118 series of 2020 kung saan po ay pinagbigay utos po ni Honorable Court Administrator Justice Jose Maidas Marquez na siya po palang panauhing pandagal natin noong nakaraang August 21 destruction, strongly advising the different courts na may jurisdiction po dito sa mga kaso involving 5 kilograms and up na kaagad-agad pong sundin ang mga provisions po ng Republic Act 9165, particularly po ang Section 21 as amended by Republic Act 10640 upang matanggap na nga po or makuha na po namin ang court orders for destruction at nang eventually po ay ma-execute namin ang court orders na sa pagsunog po nito mga bulk pieces of drug evidence na nasa kustodiya po namin at gayon din sa kustodiya ng iba pang law enforcement agencies tulad ng PNP at ng NBI. Batid po natin ang challenges dito sa paggulong po ng wheels of justice dahil nga po kapag gumugulong ang isang kaso sa illegal na droga, nangyayari po dyan, siyempre pag naghain ng motion, yung Defense Counsel ay doon po nagkakaroon ng pansamantalang delay doon po sa proseso ng ating pagtanggap ng mga court orders. Ngunit patuloy po nating patuloy tayo makikipag-ugnayan sa iba't iba pong mga prosecutors at kayo din po sa korte upang makuha na po natin yung mga kaukulang papeles.
Okay, maraming salamat po sa inyong panahon, Director Derek Carrion ng PIDEA. Stay safe po, Director.
Maraming salamat po sa ngalan po ni Director General Wilkins Villanueva. God bless po sa inyo, ma'am. Thank you very much.
Maraming salamat po, Director. Samantala, kahapon, October 11, 2020, ay nakapagtala ang Department of Health ng 339,341 total confirmed cases ng COVID-19 sa bansa matapos itong madagdagan ng 2,502. 293,075 naman ang kabuuang bilang ng mga gumaling na kahapon ay nadagdagan ng 17,057 habang 83 ang nadagdag sa mga nasawi. Nasa kabuuan ay nasa 6,329 na.
Kapansin-pansin sa ating line graph na taas-baba ang kasong na itatala sa kada araw, makikita rin na hindi pa bumababa sa 2,000 po ang COVID-19 cases na naire-report sa nakalipas na isang linggo. Sa NCR pa rin po na itala ang pinakamataas sa kaso kahapon na umabot sa 782 cases. Sumunod naman ang Rizal na nakapagtala ng 141 new cases. Ang Laguna ay nasa ikatlong pwesto na may 128 na bagong kaso. Sumunod naman ang Cavite na may 125 cases at panglima ang Bulacan na may 119 new cases.
Tulad ng ating naiulat, tuwing Lunes ay malaki ang ibinaba ng active cases dahil sa mataas na bilang ng recoveries tuwing Linggo. Kung last week ay nasa 14%, ang active cases bumaba na ito sa 11.8%, katumbas ito ng 39,945 cases. Sa bilang na ito, 3.9% ay critical, 1.8% ang severe, 11.2% ang walong sintomas, at malaking bahagi o 83% ay mild cases lamang.
Bagamat patuloy na bumababa ang bilang ng active cases, huwag pa rin kalimutang magsuot ng face mask. Ugaliin natin ang pagsusuot nito lalo na kung tayo po ay lalabas ng bahay dahil sa pamamagitan ng pagsusuot ng mask ay nababawasan nito ng 67% ang chance na tayo ay makahawa o di kaya ay mahawa ng sakit maging bida solusyon sa COVID-19. Para po sa inyong mga katanungan at concerns tungkol sa COVID-19, maaari niyo pong i-dial ang 02894-COVID o kaya ay 02894-26843. Para naman sa mga PLDT Smart Sun at TNT subscribers, i-dial ang 1555. Patuloy rin kayong makibalita sa mga pinagkakatiwalaang sources ng impormasyon tungkol sa COVID-19. Maaari niyong bisitahin ang covid19.gov.ph.
Puntaan natin ang mga balitang nakalap ng ating mga kasamahan mula sa Philippine Broadcasting Service. Hatid sa atin ni John Mogol. Take it away, John.
Yes, maraming salamat, Sec Martin, sa ating pong mga balita. 5th Infantry Division, Philippine Army at Isabela State University nagkasundo para sa mas mabisang contact tracing kumpara sa kasalukuyang manual recording na ginagawa sa lalawigan ng Isabela. Mula Tuguegarao, narito ang balita ni April Jane Salukon.
COVID Radio. Hashtag Laging Handa. Radyo Pilipinas Special Coverage.
Lumagda sa isang kasunduan ang Isabela State University at 5th Infantry Division Philippine Army para sa mas mabisang contact tracing sa mga close contacts ng mga nagpositibo sa COVID-19. Ang sistema ay tinawag na Health Guard System na inilunsad kamakailan para makatulong sa contact tracing sa probinsya ng Isabela. Nabatid ng nasabing sistema ay mas mabisa kaysa sa ginagawang manual recording sa kasalukuyan kung saan kakailanganin lamang ang mobile number at address ng isang individual at dito ay malilimitahan nito ang galaw ng bawat isa. Base sa kasunduan, ang Isabela State University ang magbibigay ng software, data storage at technical assistance sa pag-ooperate sa naturang sistema, habang ang 5th ID naman ang magbibigay ng ilan pang mga kagamitan. Ayon kay Dr. Rickmar Aquino, ang president ng Isabela State University, nakaisa ang kanilang universidad para mapigilan ang pagkalat ng COVID-19. Samantala, kasabay ng MOA signing ay ang pagpasok din sa isang kasunduan ng ISU, ng 5th ID at ng Department of Agriculture o DA Region 2 o tinawag na Team Isuda 5th ID para mailapit ang agri-based technology sa mga lugar na apektado ng insurensiya. Ang Agri-Based Technology Extension Project ay isang konsepto na maghahatid ng mas mahusay na pamamaraan upang mapalago ang agrikultura sa pamamagitan ng paggamit ng makabagong teknolohiya. Manipo dito Tuguegarao City, 18 April, sa Lucon para Radyo Pilipinas.
Samantala, pagtitinda sa temporary market site ng Tandag City sa Surigao del Sur, pinalawig ng mga kinauukulan habang patuloy pa ang contact tracing sa public market ng nasabing lungsod. Narito naman ang balita ni John Cuadrasal.
COVID Radio. Hashtag Laging Handa. Radyo Pilipinas Special Coverage.
Pinalawig ng lokal na pamahalaan ng Tandag City ang operasyon sa temporary market site dito habang pansamantalang isinara at hindi pa natatapos ang contact tracing sa Tandag City Public Market. Isinailalim simula Setyembre 25 sa Restrictive Perimeter Control ang Tandag City Public Market sa bisa ng Executive Order No. 33 ni Tandag City Mayor Roxanne Pimentel bilang hakbangin sa pagpigil sa pagkalat ng COVID-19 sa lungsod nang may magtitinda na nagpositibo sa sakit. Ayon kay Dr. J. Escandor, Market Supervisor ng Tandag City, habang patuloy pa rin ang contact tracing at hindi pa tiyak ang kaligtasan sa public market, pinalawig ang pagtitinda sa naturang temporary market site sa Vicente L. Pimentel Boulevard ng lungsod. Ani Dr. Escandor, ipinasailalim sa rapid test ang tinatayang 350 na mga magtitinda ng Tandag City Public Market kung saan 167 sa kanila ang nagpositibo at inilagay sa quarantine facility ng lungsod. Binigyang diin naman ng market supervisor na habang nananatiling bukas ang temporary market site ng lungsod, tinitiyak ng kinauukulan na makiiwas sa mga dumadayo dito sa banta ng COVID-19 tulad ng paghingi ng rapid test na may negative result mula sa mga magtitinda at pagpapatupad ng mga health and safety protocols kontra COVID-19. Gikan diri sa Tandag City, kini si John Cuadrasal, Radyo Pilipinas.
Sec Martin, yan po ang mga balita mula sa ating mga reporters dito sa Radyo Pilipinas. Balik po sa inyo ni Yusek Rocky.
Maraming salamat, John Mogol. Alamin naman natin ang pinakahuling balita mula sa PTV Cordillera kasama si Eddie Carta.
Yes, naimbag nga bigat, Secretary Martin, Yusek Rocky, smooth sailing at saka walang naging hadlang sa pagpapatupad ng blended learning sa unang linggo dito sa lungsod ng Baguio. Kasabay na rin, Secretary at saka Yusek Rocky, itong paglilibot, inspeksyon na pinangunahan mismo ni DepEd Undersecretary Alain Ray Pascua at si Mayor Benamin Magalong sa mga paaralan dito sa lungsod ng Baguio.
Ni DepEd Baguio Assistant Schools Division Superintendent Christopher Benigno na dahil sa kontribusyon at tulong ng mga stakeholders ang siyang pangunahing daan at susi sa matagumpay na pagpapatupad ng blended learning sa unang linggong pasok ng mga mag-aaral dito sa City of Pines na kung saan mas pabor ang nakararami sa printed modular learning delivery modality dito sa Cordillera Region.
Sa mga guardians at parents po natin na sila po ay partner natin sa pagpapatuloy ng edukasyon, dapat po ay magtulong-tulungan po tayo para mapangalagahan ang ating edukasyon.
Dagdag pa ng nasabing opisyal na malaki ang suporta ng FPTA Parent Academy sa Baguio na siyang katuwang nila ngayong new normal sa pagpapadala ng mga modules at pagsasagawa rin ng mga lectures. Pinangunahan naman ni DepEd Undersecretary Alain Del Pascua at Baguio City Mayor Benamin Magalong ang inspeksyon sa ilang mga DepEd DPWH implemented projects kasabay sa pagpuna ng ama ng lungsod sa ilang mga nakitaan ng substandard na patrabaho. Samantala nagpasalamat naman ang prinsipal ng Baguio City National High School Brenda Carino na siyang may pinakamalaking populasyon na mag-aaral sa Cordillera sa pakikisa ng mga magulang at mag-aaral sa pagsunod sa mga alituntuning sinasaad ng blended learning.
Thank you po sa ating mga parents, teachers, and all our learners for all collaborating with one another as we are in this pandemic time na nagkakaroon ng distance learning.
At yan ang pinakauling pag-uulat, Secretary at Yusek, dito mismo sa summer capital of the Philippines. Ito si Eddie Carta para sa Bayan.
Maraming salamat sa iyo, Eddie Carta ng PTV Cordillera. Mula Cordillera, puntahan natin ang kaganapan sa Cebu kasama si John Arua. John?
Yusek Rocky at Secretary Martin, mayong buntag, nasa mahigit 30 individual ang sasampahan ng kaso ng Cebu City Police Office matapos na nahuli sa akto na nag-iinuman sa loob ng nightclub. Bagamat na lifted na ang liquor ban sa Cebu City, bawal pa rin mag-operate ang mga nightclub at bar sa lungsod.
Mga pulis ang nightclub na ito sa Cebu City matapos na huling nag-iinuman ang mahigit 30 individual. Agad na inaresto ng mga pulis ang lahat ng mga nasa loob ng trademark bar, kabilang na ang mga dayuhang customer at manager ng naturang nightclub.
You go with us. You go with us. We will recommend for this establishment to be closed. You are not following instructions by the local government. No, you are not. We have videos showing you. So we go to the police station. Now. Right? I will go with you. Yeah, I will go with you. Even all of you there. Here. Go with us there.
Dahil dito, ipakakansela ang business permit ng naturang nightclub. Sasampahan rin ngayong araw ng kasong paglabag sa quarantine protocol ang mga naaresto.
We will be making report addressed to the city government for penalty or going towards the revocation of their business permit because that is a blatant disregard of the executive order of the mayor and clear violation. So we'll be recommending for the closure of that establishment.
Bagamat lifted na ang liquor ban sa Cebu, bawal pang mag-operate ang nightclubs at bars sa lungsod.
Based on the executive order, nightclubs, bars and nightclubs are not allowed to serve liquor. So, trademark is makonsidered na nightclub.
Nagbabala naman ang Cebu City Police sa publiko at sa lahat ng mga namamahala ng nightclubs at bars sa lungsod na hindi sila magdadalawang isip na ipakukulong ang mga ito at ipasasara ang mga establishmento kapag nahuling lumabag sa panuntunan ng pamahalaan.
Yusek Rocky, paulit-ulit na panawagan ng Cebu City Government sa publiko na seryosohin ang mga ipinatutupad na panuntunan upang maiwasan na bumalik ulit ang lungsod sa mas mahigpit na enhanced community quarantine. Mula dito sa Cebu, John Arua para sa Bayan.
PTV Cebu, magbabalita naman sa Davao City si Julius Pacot. Julius?
Mayong udto, Yusek Rocky, dahil nga sa pagtaas ng bilang ng mga pasyente ng COVID-19 na na-admit dyan sa Southern Philippines Medical Center ay inimungkahi ng DILG Region 11 ang mga LGU sa Davao Region na magpatayo ng kanilang mga sariling mga isolation facilities. Yusek Rocky, ito ang inimungkahi ng nasabing ahensya ang pagpapatayo nga ng kanilang sariling isolation facility sa bawat lokalidad sa reyon para maiwasan ang pagdami ng mga pasyente ng COVID-19 na na-confine dyan sa SPMC. Ayon kay Department of Interior and Local Government o DILG Region 11, Regional Director Alex Roldan, na nakakabahala na ang pagdami ng mga pasyente ng coronavirus disease o COVID-19 sa Southern Philippines Medical Center dahil nga sa lahat ng mga COVID patient dito ay dinadala kung saan ito ay isa sa pinakamalaking pasilidad dito sa reyon. Dagdag nito na marami na ring mga pasyente mula sa Karatig Rehiyon ang dinadala rin dyan sa SPMC. Sa kasalukuyan, base sa datos ng DOH-11, ay nasa danger zone na ang bed capacity ng SPMC. Kaya maiwasan na ang pagkapuno ng nasabing pagamutan kung ito ay may sariling isolation facility ang lahat ng mga LGU sa Rehiyon 11. Lalo-lalo kung saan doon nga i-admit ang mga asymptomatic. As of October 11, 2020, ay ang ICU bed ng SPMC ay nasa 87.88% na ang occupancy rate nito matapos okupahin na ang 29 beds sa 33 beds capacity ng ICU rooms dyan sa SPMC. 94.33% naman ang occupancy rate ng ward beds dahil okupado na ang 233 beds sa 247 beds capacity ng ward beds para sa mga pasyente ng COVID-19. Yusek Rocky, COVID-19 update naman tayo dito sa buong Davao Region. Kahapon nga ay nasa 76 sa mga kumpirmadong kaso ng COVID-19 ang nadagdag sa buong rehiyon. Kaya pumalo na sa 3,610 ang naitalang kumpirmadong kaso ng COVID-19 sa buong Davao Region. Sa bilang na yan ay nasa 691 naman ang active cases. Nasa 25 naman ang nadagdag na mga nakarecover sa nasabing sakit. Kaya umakyat nga sa 2,801 ang nakarecover sa nasabing virus sa buong Davao Region. Pero ang bad news naman ay merong 4 na nadagdag na namatay sa nasabing virus sa Davao Region kung saan nasa 180 na ang naitalang namatay dahil sa COVID-19 sa buong Davao Region. Yusek Rocky, yan muna ang latest mula dito sa Davao City. Julius Pacot para sa Bayan.
Salamat sa iyo, Julius Pacot, mula sa PTV Davao.
Samantala, Secretary, pasalamatan na rin natin ang ating mga partner agency para sa kanilang suporta sa ating programa at maging ang kapisanan ng mga broadcaster ng Pilipinas. Salamat din po sa Filipino Sign Language Access Team for COVID-19. Mabuhay po kayo.
At dyan po nagtatapos ang ating programa sa araw na ito. Ako po yung lingkod, Secretary Martin Andanar mula sa PCOO.
At ako naman po si Yusek Rocky Ignacio, Secretary, 74 days na lang at Pasko na.
Talagang malapit na, ano? Kailangan magdasal para tayo po ay mag-survive. Hanggang bukas pong muli dito sa public briefing.